I'm Dr. Levitt with Levitt Medical Aesthetics. Today we're talking about our vampire and PRP services. PRP is platelet-rich plasma. So essentially what we do with that is we draw your blood, spin it down in a centrifuge, we'll get rid of the red cells, and then we keep all the platelets and a lot of the plasma. So platelets are where all of the growth factors are. So essentially we're injecting little suitcases full of growth factor. So the PRP services that we most commonly perform are the vampire facial, which is probably the most well-known. We also do the vampire facelift, vampire breast lift, P-shot, O-shot, and you can also add PRP to halo, the cool peel, and some of our other treatments. The vampire facial and the vampire facelift sound very similar, but they're actually pretty different. So the vampire facial is what most people know. It's microneedling, and then we rub the PRP into the microneedling. So we get little channels from the needles, and then it absorbs the PRP into your skin. With the vampire facelift, we're actually injecting PRP. So it's a combination of injected PRP plus filler. So we do 1 syringe of filler, and it's spread between cheeks, nasolabial, marionette, a little bit in the lips, and sometimes a little bit above the brow to give you a little bit of a lift. And then we put PRP into a lot of those same spots. So it really gives a whole face lift. It's really good for the tear trough area if you have like hollowing under your eyes or dark circles under your eyes. So the vampire breast lift is PRP into the breast. So it's not a boob job. It's not actually gonna give you a huge lift. If you really wanna lift, you probably need to get a surgical option. However, it is really good for increasing cleavage. A lot of times after having children, the breast will become a little less full. And this is really good to add some volume back into the cleavage area. So the O-shot and the P-shot are the female and male versions, respectively, of the similar procedure. So for the O-shot, we actually inject the PRP into the vaginal area. For women, it helps increase orgasms, hence the name O-shot. It makes them easier to have and better. It increases vaginal lubrication. And it's also good if you have any issues with incontinence. So a lot of times after pregnancy, or just sometimes in general, women, if you cough or sneeze a little bit and lose a little bit of urine, for about 95% of women, this will take care of it non-surgically. So the P-shot is kind of the O-shot for men, except for men, it's really more for erectile dysfunction. So if you have any issues, if you're using Viagra, Cialis, or one of those other medications, a lot of times this will either give you better results combined with them, or sometimes you can either stop using the medications when you get the P-shot. So the P-shot is PRP into the penis. Sounds a little scary, but we do a nerve block, and you actually feel little to no pain for the entire procedure. Both the P-shot and the O-shot have no downtime other than maybe some mild soreness that day, but typically not because we do numbing ahead of time. If you have any questions about any of our vampire or PRP services, you can give us a call, come in for a consult, or check us out online at levittmedicalaesthetics.com.